Hey everybody, welcome back to the David Guttman podcast, CryoCon 2025 edition. Great guest today, Dr. Adam Boender. Really appreciate you joining me here. And so you've been a chiropractor for how long now?
Yeah, so I practiced for 10 years. I actually stopped practicing, it's been almost 8 years ago now. Built a great practice, seeing about 450 patients a week. Did that for quite a while and then sold that practice, opened up a regenerative medicine clinic where, we did everything from vitamin IV therapy, peptides, regen med. It was a great opportunity to grow, learn, and understand different modalities, how the body obviously functions.
I have a tremendous soft spot in my heart for a chiropractic. Believe it or not, when I was really severely asthmatic as a kid, and my mom found this chiropractor that used kinesiology and muscle testing and stuff like that. And I was basically cured of my asthma at 15. I went from like a healthy lung capacity test of like 65 to like 120 in 3 months.
It's amazing.
And it really was just amazing. Now, I've been to other chiropractors since that weren't nearly as good, but you find a good one and they can really change your life.
Oh, absolutely. Yeah.
So that had to be a pretty interesting pivot getting to the regenerative medicine side. I've been on TRT myself now for about 10 years. I'm just turned, actually my birthday's today. I'm 59.
Happy birthday, man.
Thank you. Yeah. But since I think I was 49 when I first went on, and man, what a difference it made.
Yeah.
But, do you mostly treating men, or is it a mix of men and women?
Yeah. I mean, right now, I work with actually a lot of clinics. So helping clinics to implement different therapies, modalities. So you have things like HRT, TRT, hormone replacement, and then there's things like peptide therapy, which peptides are different than that type of modality. They're more of optimizers to help the body kind of move into the next phase of wellness. So we can get a baseline, and then if we want to optimize, say even our sleep, muscle, recovery, anti-aging, I'm not a big fan of that word, but longevity,
right?
That's where we can plug those in. And so I help practices actually do that. And so I train clinics, organizations, speak all over the world on human optimization, human potential, and the different modalities for everything there. Yeah.
And so what are the, you look like an extremely fit guy yourself. So what are the things that you do that are like, cause I was like, if it were me, I don't want to hear what you could tell other people to do. I want to know what you do for yourself. And I figure that's what you for sure believe in.
Yeah, man. No. So eat well. That's one of the biggest things.
Sure.
Nutrition, you can't out exercise a bad diet. I'm not also a fan of diets that much. I think nutrition is the key.
Right.
So just eating well. I do a lot of carnivore, but I also know that obviously there's other things that are beneficial there. I try to sleep as much as I can, but I'm just wired that I don't. I wish I slept more. For myself, man, I do a little bit of HRT, and then I say a little bit, just regular baseline, making sure that my levels are stable. And then I have myself on my own, what I call kind of the apex protocol for my peptides. So utilizing some growth hormones, secretagogues. I am on Regenerative, which is a GLP-1 combination. It actually increases metabolism. So it's kind of a triple agonist. So GLP-1, GIP, and then glucagon. So it boosts metabolism at the same time. So I utilize a few different things, and then making sure that I get in the gym. I get in 5 days a week. I used to run. I was a sprinter in college, high school. I never wanted to run distances. My wife, cross country. So when she would run, I would actually be on a bike, which she always laughed at me for that. But started running, and then actually ended up getting an avulsion fracture with my hip. And I'm like, maybe that's God saying, don't run.
Right.
So now I do about 20-25 minutes of just hard walking. So incline, anywhere between a 6 to a 12, and do that for 20-25 minutes, get the heart going. And that's been the key for me. So.
All right. So I got a question. I used to do triathlon. I was a pretty competitive age group triathlete for about 5 years in my early 20s. And man, it's really hard on your body.
Oh yeah.
And I never liked running, especially distances. I was reasonably fast, but I hated every minute of it.
Yeah.
And then part of me, the other thing too, is it's not relaxing to me at all, because I'm super self-competitive. So how's my split time? And is it better than yesterday or worse than yesterday? Yeah. So like, I'm more stressed when I finish than when I start, right? So it didn't do any of the things.
Yeah.
And just in the last year, I started walking. So my wife and I are going hour and a half walks.
Yeah.
And I guess my question is, from a metabolic standpoint, I mean, obviously you're burning a lot less calories when you're, when you're running versus walking, but when you think about the distance, so if I ran 4 miles versus I walked 4 miles, how different is the caloric impact on that?
Yeah, I mean, it's a great question. You also have to look at, you can look at your heart rate variabilities while whether you're running, whether you're not. I think that a lot of times when you are, and I'm going to take it away from the caloric impact, more so than to the physical impact. Because when you're running, you are putting a lot of stress, ankles, knees, hips. And I think that can put your body more into a stress state, which I think then your body's also holding on and it's releasing some of those stress hormones, where I've just been researching more and more into, again, walking or rucking even, where you can put the weighted vests on, go out. So that'd be my next challenge to you, is keep doing what you're doing. Go buy a ruck bag.
I just bought weight vests for me and my wife.
Okay.
We literally just bought them.
Yeah.
And I'm probably too aggressive because I got the weights all the way from 5 up to 20. I'm probably not going to start with 20.
I'd be a guy's like, I'm just going to go 20. I'm just going to go right to that. But I'm just going to say, start low, go slow, and build that up. But, I think it's too often, I think we have to try, and I did this myself. I was trying to push myself to the physical fitness that I'm in right now. I'm 182, I'm 8.5% body fat. And I didn't even get that.
That's very precise.
Yeah, well, I just did the in-body scan, so
there you go.
That's how I know. But I felt like I had to run to get there,
right?
And so then all of a sudden I'm running to stay lean, and I'm like, this is not why I should be running. Until I actually did break my hip, and I'm like, well, I can't do this, and that's where I think I had that shift. It's kind of like any other thing. Like some people have a heart attack to have a shift. Some people have a stroke. I had an avulsion fracture in my hip. And I'm like, I'm not going to stop exercising. I'm not going to stop doing it, but what can I do to transition that? And honestly, man, I've just by doing that more intense walking, hour and a half, or even 20, 25 minutes at a steady high incline, I go about 3.5 to 4 on the speed. I'm leaner than I was when I was running. And I don't think it's always about the caloric output that we're getting. It's also then what are we putting in based on that. I'm saying, I like carnivore, I like protein, but healthy fats are just as essential. Yeah. And that's going to help with more of that burn, to create that beta oxidation, fat breakdown, to allow the body to be in a more ketonic state, which I think is good. But it's in a sense, it's a less is more kind of. I truly think.
It's actually funny you say less is more, because that's the other thing too, is like back when I was wrestling in college, like I was training between 4 and 6 hours a day, depending on the day, between lifting and cardio and practice and all that. Now I'm doing exactly the opposite. Like, how can I shrink the amount of time doing the top of the workouts, 4 minutes?
Yeah.
And I feel like that's helping my VO2 max more than if I go for a 40-minute run, and way less wear and tear on my body.
Absolutely.
Are you in that mindset too? Or are you like, I like to spend a couple hours in the gym, really getting after it?
No, I truly think less is more. I'm not a big fan. I've been working out since I was 3rd grade. Right. It's like I got into it. I wanted to. My uncle gave me my first weight bench. It was in the basement. I'm like, I just love working out. But part of it is like, as an entrepreneur as well, it's like, time is valuable. I like to get in, get out. I also love to talk though. So that's what I get to the gym. Right. We're like, what are you doing? What's this? And then I end up chatting
at least
too much.
There's a wear and tear in your body when you're talking.
Right, I know. As I'm working the jawbone right here. That's what it is. But no, I truly think that, like the Tabata and, a lot of the intermittent workouts, you're working your heart, you're getting it pumped up, you're bringing it back down, and you're building out those shock proteins too. So I think that it's a better benefit. I think the old days of trying to work out for an hour and a half to 2 hours to try to get a result, they should be over, because they don't work. Yeah.
Well, so let's go back to the peptides for a minute. So I'm doing TRT, but I'm not doing peptides. Maybe talk a little bit about that and the integration between those two. And I'm assuming they probably build on each other, if I had to guess. Or?
Yeah, they do. So think of hormones as kind of like a more systemic. It's going to hit everything. You need to rebalance, how your hormones are doing. And it's not just like total testosterone. You look at your free testosterone. You look at DHEA, sex-binding globulins. There's all these different things you want to have balanced.
Right.
Now, that's going to get you to where you're at. Now, if you wanted to take it to the next level, what we look at is your growth hormone. So that's where I'd be saying, well, your testosterone is balanced, but what about your growth hormone? And by the time you hit 30, your natural growth hormone production drops by about 10 to 15% every decade.
Okay.
So that's a hormone that helps with just longevity, it helps with sleep, helps with repair. So I can build up as much testosterone as I want. I could, and testosterone isn't about like getting big, strong, all these things. It's just getting you back to normal rhythm is what I say. Because women need it too, just in less doses. But the peptides, they truly optimize how your body is functioning. So it'll optimize how the pituitary releases natural growth hormone. It's one of those things where your body naturally produces peptides. It just becomes less efficient of utilizing them as we age.
Got it.
So you can have peptides that, like BPC 157 is a pretty common one. Most people have heard of that. It stands for body protection compound. It's from the gastric lining in your gut. And so you can create this basically a synthetic form of that exact same peptide. And peptides by nature sort of step back. They're just amino acids. So amino acids are signaling molecules within the body, but they're a very specific sequence of amino acids. So we could have 4 amino acids lined up, all tied together. But if I change this amino acid with this one, now we have a completely different peptide.
Okay.
And so it's between 2 to 50 different amino acid chains. And then when you combine those, then you go from amino acids to peptides and then peptides to proteins. So they're all just signaling molecules that, in a sense, create the code of your body of how it functions, how it heals, how it restores. So BPC is a great one for recovery, for joints, anti-inflammatory, releases endothelial nitric oxide, which is really good for that circulation, getting to those areas that have very little circulation, ligaments, tendons, cartilage, works very, very well. So yeah, whereas again, HRT, TRT is going to balance the hormone overall. Peptides are going to optimize then kind of the next level systems, and very specific, very precise, and you can kind of trigger based on what you need. So
a guy like me, 59, I live in Miami, and I want to, I actually don't have, someone that I used to go to someone back in Chicago, which is where I still get my stuff from. But then I'm just doing TRT. I want to be, and I can tell you just by how lackadaisical they are, they're not nearly as scientific as I know they should be. Right. And how often should, who should I be going to? How often should I be getting my blood work done? How often should they be maybe making tweaks to the peptides that I'm on and things like that?
Yeah. So typically if they're running blood work, I mean, there's no specific blood work that like identifies X, Y, and Z deficiency in peptides. We still look at regular numbers, like what are your liver enzymes? What does that look like? Inflammation factors. Obviously going to a health professional or getting to a wellness coach that has an understanding of what peptides can do. Because there's a lot of practitioners, a lot of people that don't fully understand.
Where do I find a wellness coach that knows what they're doing? That's
a great one. First thing that I ask a wellness practitioner is, do you understand what peptides are? That's the first thing. It's pretty simple. There's not a lot of them. We have a great network. So our Next Level network helps people to find those practitioners. But we, it's honestly the first thing is asking. It's newer in the industry. There's a lot of people that do have a baseline understanding. But if they're not referencing them to you when they're talking about, your hormone optimization or anything else, they probably don't have a vast understanding of it. You could mention something again, like BPC, and they're like, oh yeah, I've heard about it, but I don't know much about it. But our Next Level coaching, so we have a coaching and consulting company that helps people to navigate really the peptide world. And I say that's more so understanding what your goals, what your needs are. If it's sleep, if it's energy, if it's,
I definitely need to get that from you when we're done here. So, because I'm in bad need. And I know I'm not the only one too. And the problem too is, I mean, man, you want to talk about having failed us. Our medical system is just an absolute disaster. I mean, I hear and listen to Gary Brecka on stage last night. I mean, you really listen to like, it sounds like he could literally probably cure anything. And, and you go to a regular doctor and they barely know their ass from their elbow. It's unbelievable.
Well, and I think it just in clarity of that too, it's incredible because he did, he was talking about optimization and I'm listening to him like, man, this is so familiar to like the presentation that I give on human optimization. It really is, there's a lack of communication. I mean, disease and the process of disease really comes down to just a few things. It comes down to the environment. So what's happening inside, the orchestration of that environment, the resources the environment has. And so we have to reestablish these things because if we're not communicating, if our cells aren't communicating, that's where when Gary says, hey, you can look at this chart and we can see where the breakdown is on this methylation A or B or whatever it may be. And it's not him that's curing this thing. It's finding the gap
Right.
and then filling where that gap is. And that's honestly one of the things that peptides do, which is incredible, is it fills where those gaps are, and they can be very specific in those signals. And that is one thing that he goes, I'm not here to cure anything. And I don't think doctors cure anything. I don't think doctors are even made to cure anything. It's to give a resource when we can figure out, when we really listen to a patient or a client to say, hey, this may be missing. This one, and sometimes it's simple. B12.
Right.
If this one thing could be missing, let's fuel your body with the thing that it's lacking and go from there.
It's funny, when I listened to Gary, it reminded me of that chiropractor I told you that cured my asthma. Because what he would do is he would be like, okay, the lungs are, the adrenal glands are super important to your lungs functioning properly. And then he would muscle test and say, oh, you have a weakness in your adrenal glands. So he'd validate with muscle testing that I had a weakness there. And then he'd say, these supplements often help. And then he would test each one on my tongue and then retest, do the muscle testing. And it all made perfect sense. And part of what I loved about listening to Gary talk was everything he said made sense.
Right.
When I hear a doctor talk, nothing they say. Well, what causes that? Who knows? It's genetics.
You're old. Wait.
Right.
All of my issues just because I'm old? I said, it's like, we are all going to get older. That doesn't mean we have to get old.
Right.
You can get into the studies of epigenetics and chronological age versus biological age. They are two different things. And it's been shown in research now. Truly, I'm 63.
Oh my God, you're 63. Wow.
No, not really, but most of you thought that I was for a second there. No.
You're not 63.
No, I'm 43.
I was like, oh my God, you look amazing.
This is what peptides will do for you. No. But truly, we are now able to begin to see that, age in and of itself is a disease or a state of dis-ease, because ultimately what it comes down to is our cells. Our cells, they have a very specific lifespan. Yeah. It's actually called the Hayflick limit. This is how many times these cells will replicate and divide and go. And that's what our telomeres are. So DNA, our telomeres, every time a cell replicates, that telomere gets a little bit shorter. But what if we could actually just slow down that replication process, the dying off of these cells, which is, you have autophagy, which is cleaning up a cell, senescent cells, which are those dead and dying. And if they don't actually think their job is done, then they actually become these really cool things called zombie cells. They're actually not cool because they're basically like a little inflammatory fireballs going through your body.
Okay.
And so you need to be able to clean those things up. But if we could slow down that cell replication, that slows down how our DNA actually over time becomes damaged. And so aging is just fast replication of these cells dying off too quickly. So I don't even talk about anti-aging. I'm not a big fan of it. I talk about longevity, which is even more important. Anti-aging is like an external thing, whereas longevity is the internal. And even biohacking is a term I really try to transition from, because at last conference I carried an axe around with me, and I know everyone's like, "What?" And somebody's like, "Are you like the transporter guy? Like, what is it with this axe?" And I go, "No, this is to show people that they need to stop hacking their health, because hacking is a forceful movement, whereas we really want to transition to optimize." So biooptimization is not just trying to hack something into place, because then it just becomes, well, we're going to use this hack and then this hack. There's no long-term anything there. Whereas if you can optimize something, that creates longevity. So creating that cell-to-cell communication, cleaning up an environment, giving the resources of the body that it needs, that's kind of where, the body can do what it's supposed to. It's designed to heal. We just interfere too much.
Well, so you mentioned sleep before, and you may not be a sleep expert necessarily, but one of the things that I find a little frustrating myself is everyone's like, I even have, I would think I have the 8 sleep. It's even built into the name. You're supposed to get 8 hours of sleep. And if you don't get 8 hours of sleep, you're bad, right? I can't get 8 hours. Like if somewhere between 5.5 and 6.5 hours, I don't have to set an alarm. I wake up and I'm rested. And I'm like, you can't tell me there's no differences between gender, age, and genetics. There has to be.
Oh, there is.
There has to be a range. And like, how can I tell, other than I feel rested, maybe that's all that matters, that I'm getting the right amount of sleep? Because my Oura Ring says my sleep efficiency is not good enough because I'm not getting 8 hours of sleep.
See, I think that this can go all the way into lab testing too, because how many times have people gone into their doctor and they're like, well, we'll talk about like TRT, testosterone. It's like, well, your testosterone is 120. You're good. It's like, what? It's like, it's in range. I'm like, yeah, that's not range.
Right.
That's a standard range.
Right.
I mean, tell me, is the standard American diet good?
Oh, it's fucking
No.
right,
So
yeah.
anything that really says standard should really mean nothing.
Right.
Because who sets that standard?
And they move the goalposts all the time too.
Right. Okay. So sleep. I'm like a 4-hour sleep person. Like,
okay.
So
That's
people like,
that's
like,
another
that's
level.
horrible. And I think
I feel
more
better now though,
important-
actually. I have 6.5, 6. I'm like, wow, okay.
So my Oura ring would probably like blow up because it's like, hey, you're doing nothing. But yet I think it's more about the quality of the sleep.
Okay.
If you can get into that restful state, and even then, like we work with an Alzheimer's Foundation, we realized that the number one cause for Alzheimer's is not this plaquing. It's actually the lack of getting into a deep delta sleep. That's what is actually shown to create this issue neurologically to disrupt the synapses of the brain.
Right.
And so truly, I don't think it's about the hours.
Okay.
It's like anything, it's quantity over quality. Well, we talk about it all the time, but for some reason, when it comes to sleep, that's just thrown out the door or anything else. So
have you tried the brain tap thing?
Oh yeah. I think it's incredible.
Because I just bought one myself today. I'm like, because he's saying, because I get between 40 and 60 minutes of deep sleep.
Yeah.
And they're saying, one guy's telling me you should be getting like 2 hours. I'm nowhere near that.
Yeah. See, even then, so you start looking at deep levels of sleep, your REM sleep, your delta sleep. I mean, then there's so many different, and I am not a sleep expert. I'm but even in the delta sleep ranges, and when you get into REM, like there's like 4 layers there. Oh. Okay. And so, again, going back to the Alzheimer's, we were talking to them about this range of sleep, and me being the peptide guy, I'm like, is there a peptide that like gets people in there? And there is one. It's actually called DSIP, Delta Sleep Inducing Peptide. Okay. Was utilized for jet lag. And so by utilizing that peptide, it puts you down into that deep level sleep, into the actual delta level sleep that you need. There's also one called epithalin or epitalin. Epithalin is another peptide when it comes to sleep. I know we're talking about sleep, DSIP, epithalin. It's a bioregulator. And what it does is it actually helps with DNA repair, telomerase activity, so slows down, in a sense, the die-off of cells. And so if we can slow down cell replication or that die-off of cells, that increases longevity. But when it comes to sleep, it actually affects 3 different receptors on the pineal gland that helps get you into deep level sleep. And I didn't realize this until one of the ladies that I work with, she wears one of those Whoop watches, right? Kind of like the Oura ring. Yeah. And she had been through like toxic mold issues, illness. And I said, hey, I just want you to start with epithalin. It's 10 days. You take 10 milligrams for 10 days straight. You only do it once or twice a year. And it's like a reset for your whole system. And she says, all right, let's try it. Nothing else is working. 3 days in, she gives me a call. She's like, you're not going to believe what's happening. And I'm like, what's happening? She goes, so my Whoop watch, I've been tracking my sleep, my deep rest sleep for over a year. She goes, I've never been over like 37% or her number was 37. She goes, I'm 3 days in, I'm in the 50s. Wow. And I'm like, wow, okay. So she keeps going through this and finishes off seven more days. Months later, and we're still talking through this, she's like, my sleep is still 50s or above. She's like, and her cycle was always irregular. Cycle's regular now. And so sometimes just a single peptide like that can reset a system. I know we're talking about sleep, but we know that even if we reset our sleep, we can reset neurological signals. We can reset endocrine signals. And it's just phenomenal sometimes what these peptides can do and the different effects that they have. And sometimes we don't know all the different effects they're going to have. Right. But science is clear that they work. They work very, very well.
So you mentioned the Whoop. I have the Oura ring. I've also tried the Apple Watch. I've got the 8 Sleep to measure stuff. What do you think is the best tracker? Do you have an opinion there?
I really don't. I think just having some sort of tracking system. It's just people that want to monitor where they're going. I guess the thing is, whether it's a Whoop, whether it's an Oura, if you're gonna get it, utilize it.
Right.
Like, use it to actually help you get to where you want to go, as opposed to just wearing it and just seeing the numbers. Her HRV, I was going to say, I actually forgot about that one. Her HRV has actually improved as well from that too. So that heart rate variability. And
heart rate variability, by the way, so mine basically says I'm a corpse. All my numbers are good. My heart rate variability, I actually just tested with the Brain Tap guys, is a 7. Okay, they're like anything below like 40 is like bad, really bad. And I'm like a 7. And it seems like nothing even, like all the things, the list of things you're supposed to do to improve your heart rate variability, I do all of those and it doesn't change anything. And then they're like, oh, well, don't worry about it. I'm like, well, then what
you
the
just
hell
told me
measure?
that.
Right.
You just said I'm like dead. So,
Right. Like, do you know anything about heart rate variability? Is there
bits and pieces. I just know obviously numbers of where you should be, but honestly, for something like you, I'd say I can't tell you why it's there. I don't think they can tell you why. I don't think you figured out why.
Definitely not.
But my only thought would be like, you know what? I'd probably try to just do a reset.
Right.
Utilizing something like epithalin, there has to be a signal somewhere that's not being triggered. I couldn't tell you where it's at.
Sounds like a job for Gary Brecka.
Yeah, I mean, he would probably be able to figure it out. He'd be like, oh, it's this.
That's interesting.
But yeah, it is interesting. I wish I could dive deeper into that.
No,
but
that's okay.
Yeah.
Well, look, I really appreciate this conversation. I think it's been super helpful for me. I hope it's been helpful to some of the listeners. Where can people find you?
Yeah, so Legacy Bioscience is our online company. We have myself, I am at _doctor guy on Instagram. So, and you have to spell out doctor, not DR, but yeah, at that doctor guy on Instagram. And then nextlevel.com, that's our company. So that's the best place to find us. And if you really want to reach out to me, just hit me up on Instagram.
Dr. Adam Boender, thank you so much.
Yeah, thank you.
Appreciate your time.
It. Yeah.